BAC is a buildup of plaque in the arteries of the breast.
And that could be a red flag that you're at risk for heart disease or stroke.
I was just with the director of the Heart Women's Program at Katz Institute for Women's Health to learn more about what a mammogram can show us. So Dr. Graver, what am I looking at here?
So you're looking at an image of a breast. This is a mammogram of a breast of a patient who was 55 years old and now 59 years old. And what we're specifically looking at is, if you can take a look, is these sort of wide delineated lines. This is what's called breast arterial calcification. So what is a breast arterial calcification? It is a calcium deposit within the middle portion of an artery, right? So what we know about this at this period of time is that BAC, that's what it's referred to as at this point, BAC is something that was not associated in the past with breast cancer.
Okay.
So mammograms stop actually reporting them. However, the most recent research shows the fact that BAC is actually correlated with potentially early atherosclerotic cardiovascular disease. So what we need to know now is, number one, are the mammograms all reporting the BAC? What is the severity of that score? And is that severity at this period of time correlated with atherosclerotic disease? The most important thing for me as a physician, as a clinician, is that now that we have this reporting of BAC, what do we do with it?
Right.
Where do we go? Like, what do I tell my patients? So the best thing to do is this: bring them into the office, assess whether or not they have any symptoms or not. Meaning, are they having any chest pain, shortness of breath, palpitations? Are they active? Do they have symptoms upon activity or not? The first thing you want to do is you have to get an EKG, a baseline electrocardiogram. But electrocardiograms are limited because electrocardiograms tell us as to what is happening with your heart at the time that the stickers are on you.
Okay.
It doesn't have any prognostic features, meaning I can't tell you what can happen to your heart 2 minutes after you walk out of my office.
Sure.
So that's where the stress times comes along, right?
And then what do you do with that information once you get that data?
So once we have that data, we can then correlate it. Does this patient is a low risk cardiovascular, moderate, or high risk, right? And we look at certain things. We look at how long does the patient stand on the treadmill. Are there any significant EKG changes? Do they have symptoms? Do they have chest pain, shortness of breath? Do they immediately need to stop the treadmill because they just can't go on? And that's where we really need to understand the patient's heart function, right? And the heart function comes in the form of understanding their echocardiogram, ultrasound of the heart. That gives an understanding as to how well the heart is squeezing, whether or not there's any underlying valvular disease. And that's sort of the baseline evaluation for some of the patients that do have BAC.
Wow, technology really has come a long way.
It's amazing, right?
All right, well, make sure you go get everything checked out regularly.